Hello and welcome to yet another episode of Dr. Sim. In this episode, we are going to talk about hernia, and we have with us Dr. Pawanindra Lal, who is going to talk more about it. Let us welcome him to the program. Welcome, doctor.
Thank you.
First of all, we would like to know more about you.
Well, I'm a professor of surgery at Maulana Azad Medical College, New Delhi. I am a consultant laparoscopic, gastrointestinal and bariatric surgeon, and I'm also involved in training candidates for minimal access surgery. We run a fellowship program here in the institute, and we take in 2 candidates for a postdoctoral fellowship every year. So it's a busy department with 16 postgraduates being admitted every year and 2 fellows for training in minimal access surgery for a 2-year program.
Okay. So now coming on to the topic, what is hernia actually?
Right. So hernia is a very common problem. Technically, it is described as the protrusion or coming out of a body part from a defect of the abdominal wall. So we have an abdominal wall which we have, in which we have some natural defects and some man-made defects. The natural defects are which are normally there in all of us, and we are therefore liable to develop a hernia along those natural lines or defects. But there are people, some of us, who get operated and we get incisions on our abdomen, and when those incisions are closed, we get prone to hernias through weaknesses in the abdominal wall where the sutures have been applied earlier. So those are the acquired types of hernias. So basically, hernia for a common man or a common understanding is where the abdominal contents, which are mainly bowel, comes out outside into the layers of the abdominal wall through a defect which is either natural or acquired. And there are many types of hernias.
Where do hernias occur usually?
Well, they normally occur on the front part of the abdomen. They occur in the lower part of the abdomen. The hernias which are in the lower part of the abdomen normally are referred to as inguinal hernias, and the inguinal hernias can be direct hernias or indirect hernias depending on the location of the hernia itself. The hernias which take place from the front of the abdomen are could be of various types depending on the location. They can be in the upper part of the abdomen, they can be around the umbilicus, which is the place where there is the umbilical cord attachment, and then there could be hernias in the lower part of the abdomen. And then if a person has got scars because of previous surgery, then the hernia can be there from those scars. So that will be anywhere. Wherever the scar is, the hernia can take place from there.
What are the symptoms of hernias?
The majority of the patients would come with a swelling. Whenever there is a hernia, they will have a bulge coming out from the part of the abdominal wall wherever there is a hernia. So the commonest complaint is that there is a swelling, doctor. What is this swelling due to? Also, that swelling can be accompanied with a dragging sensation, because that swelling is nothing but some bowel content coming in or some part of the fat which we call as omentum. And whenever that comes outside, and if it comes out and hangs a little bit bigger, then it can give a dragging sensation. Also, usually the hernias are supposed to come out when the person is erect posture and go back when the person is lying down. So this can happen, and if this happens, it is still fine, because at least the opening is free. But sometimes what can happen is the bowel or whatever is coming out gets stuck to the inside or the hole, that abnormal hole, and in that case the contents do not go back when the patient lies down, and that becomes a cause of worry, because then it can cause more pain, and sometimes the bowel can get stuck, and there could be obstruction to the lumen of the bowel, and the patients may get vomiting, patients may stop passing flatus, patients may have distension of the abdomen, and this becomes an emergency. And because of this reason, we always say that any abdominal wall hernia must be repaired, must be operated, because if this unforeseen complication of obstruction takes place, then it becomes a very major surgery, and the patients may actually need to lose a length of the bowel if the bowel also gets loses its blood supply and gets strangulated.
Okay. Can hernias be prevented?
Well, to be honest, no. I think the natural hernias cannot be prevented. You are always born with the defects in the abdominal wall, and males in particular have got more tendency for these natural hernias because the testes are lying in the scrotum, and there is a natural defect which carries the blood supply onto the testes in the scrotum. So hernias takes place alongside that defect. So really speaking, all male are prone to get a hernia, but we can't prevent anything about it. What one can do is in the ones which you get after surgery, if the surgical work is done properly, then that is one way in which one can prevent hernias. And the other is that if the person has got a hernia, has got an abdominal operation done, he should avoid lifting up heavy weights and do heavy exercises for the first few months after surgery. If that surgical work is all right, then there is not much risk of developing a hernia. But still, the fact of the matter is we do develop hernias, both the natural hernias as well as the acquired hernias. And all one can do is not really prevent, but I would say get attention to these hernias at an early stage.
Are hernias hereditary?
No, I would not say that. Some types of hernias are more in one type of sexes. As I said, inguinal hernias are more common in males. Even the females, they have got a higher chances of inguinal hernias than the other type of hernia, which is the femoral hernia. But femoral hernias per se are more common in females. So that is a gender difference because of the make of the body, difference between a male and a female pelvic body. But no, I would not say that hernias are hereditary. We do not get it from our parents, but we do get our body habitus from our parents. The simple answer to that question is no, they are not hereditary, but they are either acquired through the natural defects that our bodies have or through the operative procedures that we undergo for procedures, and then there is a defect or a weakness in the abdominal wall and the abdominal contents come out.
Can heavy lifting cause hernias?
Yes, heavy lifting does make patients prone for hernias, and you would have seen weightlifters in competitions. They use belts in their lower abdomen. They tie up a belt, they belt it up, and then they go for lifting the weight. That is all because this lower part of the body, which has got our natural defect in all males, is prone to get the burden of pressure when you lift heavy weight, and therefore when sudden jerks takes place or some heavy item is lifted, the muscles stretch and there is a tear. So there is a muscle stretch, there is a tear, and the tear becomes a hole. So yes, it is work related. People who do heavy manual exercise or heavy work do tend to get more hernias. And also people who have got certain types of illnesses are more prone to getting hernias. For example, if there is an elderly person who is coughing all the time, then he is putting extra pressure on his abdominal muscles, and that makes a person prone for getting hernias. Similarly, if the person has got a problem of abnormal bowel habit, he is constipated and he is using a lot of his physical energy to pass his motions, then again that makes a person more prone for hernias. Similarly, if there is any work where you need to do straining or heavy lifting, it makes a person more at risk for developing hernia.
What about smoking? Does it cause hernia?
Smoking, I would say, does not have a direct effect, but it does have an indirect effect. The indirect effect is in reducing the immunity of the patient, delaying the healing process. So, and also, as I said, coughing. Smoking would lead to coughing, and coughing would predispose a person to lot of pressure in the abdomen and therefore more chances of hernia. So smoking is not having a direct effect, it is having an indirect effect in causing a hernia.
What are the advice you usually give to the patients before the surgery is done?
Yes, so before a surgical procedure, we always advise the patients to go for good exercises for the lungs, If they are smoking, they should not be smoking. They should have a normal bowel habit. They should not be doing anything which causes straining or extra pressure on the abdominal wall muscles, because you can imagine we do an operative procedure, we have done a procedure to repair, and then post-operatively the patient starts coughing or the patient starts straining. It will put unnecessary pressure on the place where the hernia repair has been done. So we prepare our patients to optimize them so that the post-operative result is best.
What kind of treatments are given for the patients?
Right. I think that's a very important question, because these days there is a lot of technical and technological advancement in science, and what was earlier being done through big cuts, which we call it as open hernia repair, is now being dealt with by a keyhole surgery method, which is laparoscopic surgery, or also known as minimal access surgery. So the entire trauma that we used to cause to the patient by way of large incisions has now gone away. Patient has got smaller incisions, patient's post-operative pain is much less, and patient's recovery from the operation is much quicker, patient's hospital stay is much shorter, patient's getting back to work is much faster, and all in all, it's a win-win situation for the patient. So that in the last 10 to 15 years has been the major advancement that surgical science has given to the patient for hernia management. So as of now, we do two types of operations. We do open hernia operations, where you incise, you repair the defect, you put a mesh, and then you suture up the skin. Or we do a laparoscopic hernia repair, which is the keyhole method, where we do whole operation through endoscope, through a vision which we see on a camera, and we put in a mesh there also, but it is much more physiological, because the mesh is placed on the inside surface. It fixes much better, and results have shown that the outcomes and the benefits are as good as open surgery, or even better, because patients get much less pain. They do not have that much of need for analgesic drugs, and as I told you already, their stay in the hospital is much less. They can get back to work much faster, and therefore increasingly patients are choosing this minimal access surgery for repair of hernia. Now the problem is, who does this surgery? Because majority people still in the world are surgeons who are trained with open surgery. Most surgeons are not trained in laparoscopic surgery or minimal access surgery. So our endeavor as an organization, or as an institution, or me as an individual, is to train more and more surgeons in the art and craft of laparoscopic surgery, so that we can increase the number of surgeons doing this kind of surgery, and therefore spread this benefit to more patients worldwide.
What are the risk factors of doing the surgery?
Well, there are risks for any kind of surgery. There are two types of risks. One risk is associated with the anesthesia of surgery. That means you have to put the patient to sleep, and a risk will be associated with the risk of the drugs that the patient gets, and the patient has to wake up after surgery. So those are one type of risks. The other type of risk is because of the procedure that we do. I would still say that nowadays, with the expertise available, the benefit of laparoscopic surgery and the training of laparoscopic surgery has now come to such a level that there is no difference in complications between minimal access surgery and the open hernia surgery. Earlier there was a feeling that open surgery is much safer, it has got a lesser complication rate, and the laparoscopic surgery causes more complications. But now, with surgeons having been trained properly in the art and craft of this surgery, with their years of experience, we are now able to deliver them results which are not only equal but even better than the open surgical results. So I would say complication rates are reduced. Now, what are the types of complications that can take place in any surgery? Well, if there is bleeding, then there could be a swelling post surgery, there could be a hematoma or a swelling, which normally does not occur, but that is one thing. The other thing which is most dreaded is infection. You don't want infection because you are putting a mesh. In all these surgeries, we put a mesh inside the patient's body, and that mesh is to give added strength to the weak abdominal wall musculature. So because there is a weakness, we assess what size of mesh is required, and this mesh is a prosthetic material. It is an artificial material made of synthetic stuff like polypropylene or polyester, and it does not have any scope for infection. So we have to ensure, and all surgeons have to ensure, that whenever this type of surgery is done, it is done in most aseptic precautions. The theater has to be absolutely first class. The autoclaving and sterilization has to be optimum, and we need to ensure that these cases are done first in the day and not end of the day. So infection is a second big risk which is there, and then third risk is any injury which takes place to the inside organs which are there. So because I told you there could be bowel in the hernia, there could be fat in the hernia. When you separate these organs, you could cause some injury which is unintended injury, and if it is recognized, it can be dealt with there and then, but if it is missed, it can be a problem. So these are the normal risks of any surgery, and well-trained surgeons obviously take all efforts to ensure that these complications are kept to the bare minimum.
What kind of anesthesia is given for the patients?
Right, I think that's a very good question. In the open surgery, for the lower abdominal surgery, that means anything, when we say lower abdomen, my easy point of reference is the umbilicus. Any surgery where we want to do below the umbilicus could be done under general anesthesia or spinal anesthesia, where you put a needle into the spine and you just anesthetize the lower part of the body. So that is for open surgery. But for laparoscopic surgery, we need to inflate carbon dioxide in the abdomen to make space. We work inside the abdomen, and because we need to inflate carbon dioxide in the abdomen and swell it up like that, we need the whole patient to be sleeping. So laparoscopic surgery would always need general anesthesia, and that is the only point which becomes a point of difference when you are talking and comparing it with open surgery, because some of the open surgery can be done even in local anesthesia or in lesser forms of anesthesia, but laparoscopic surgery would always need a general anesthesia. So first and foremost, we want that our patient should be absolutely fit. He should be fit to be having a general anesthesia, so that after the surgery he wakes up. General anesthesia in the present day and age has become very, very safe. Gone are those days when general anesthesia used to be very, very fearful. Nowadays, the advances in drugs are so good, the equipment is so nice that patients can actually wake up and go back home after 3 or 4 hours of surgery, even after general anesthesia. It has become that good.
What is the actual cost of the surgery?
The cost of surgery depends upon the type of surgery being done. It is little bit more cheaper when we do open surgery, because the mesh that we put is a simple mesh which is quite reasonable, and normally the cost of the mesh is about 2,000 rupees, and to that we add the cost of the operation, which could be about 15 to 25,000 rupees. So that could be the package of a open hernia operation. Okay. But when we talk of, and is that all right to tell you in rupees? Yeah, it is acceptable in rupees, yeah. So, but when we talk about laparoscopic surgery, it becomes a little more expensive, because the meshes that we use in laparoscopic surgery are more expensive because they are specialized. Why they are specialized? They are because the mesh needs to be put in contact with the bowel, and these are special meshes which make sure that the bowel does not get stuck to the mesh. So therefore they are more expensive, and the cost of surgery then goes about 15 to 20,000 higher than the open surgery. So that is roughly the difference between the cost of an open surgery and a laparoscopic surgery. You will have to add another 10 to 20,000 more. Plus, there are some more equipments that are added. You need to fix the hernia, the mesh to the abdominal wall, and that again, if that one is used, then that would be another 10 to 15,000 cost extra. So on the whole, if you see the package cost of a laparoscopic hernia may be about 40,000 rupees more costlier than the open hernia operation.
Okay. For how long does the patient have to be hospitalized?
Well, that's the most beautiful part. The laparoscopic hernia patient can actually be going home the same day if he's fit, if he's healthy, and if he has woken up nicely from his anesthesia. So at best, one more day after surgery. So just today operation, and then next day the patient goes home. Okay. It could be as good as that. The discharge from the hospital is very good, and the person is able to do all his activities. That's the most amazing part. You don't need a support of another person like normally it happens, because there is no cut in the abdominal wall. Whereas when you give a incision in the open operation, because there is a big incision, the patient gets lot of post-operative pain, and because of the post-operative pain, the patient tends to hold on to that part of the abdomen wall, and then he needs help to pick himself up from the bed and then to be carried to the toilet, and all that happens. But in laparoscopic surgery, all that is gone. There are just small keyholes, and the patient comes back, he's able to go to the toilet, do his normal routines much more easily than the open hernia. So I would say 1 to 2 days is the time by which the patient would be back into his home after a laparoscopic operation.
What advice do you usually give to the patients once the surgery is done?
Well, normally we tell the patients that they can resume their normal activities as soon as they feel they are happy to do so. We, in the open era, when we do an open hernia operation, we tell these patients not to lift heavy weights and not to bend forward for at least 3 months. The reason is the mesh is placed anteriorly on the anterior part of the abdominal wall, and if there is a lot of weight being pulled up by the patient, then there is a chance of the sutures being cut open, So for open operation, they need to take very much a lot of precaution for first 3 months after surgery, and they need to make sure that they don't get up with a jerk, do not lift heavy buckets or heavy things or suitcases by bending forwards from forwards and upwards like that. But after laparoscopic surgery, we do not give much restriction to the patients, because the mesh is fixed on the inside, and they really don't need to be they need not exercise that much care as they would do in a open operation. So in a laparoscopic operation, we would say that for the first week to 10 days, the patient should take normal movements in the house, normal activities can be done, and he can get back to his work as soon as he feels he is confident to do so. So we have got patients actually who drive next day to their work or to come to the hospital. They actually drive themselves without any help, and they've had their abdominal operation in a hernia. So it is that kind of a revolution that the laparoscopic hernia operation has done as comparison to the open operation.
Lastly, what advice you would like to give to the audience?
Well, I would like to give the best advice to the audience is that if you notice any kind of a swelling related to your abdominal wall, you should bring it to the notice of your doctor, whoever it is, whether it's the general physician or a surgeon, better a surgeon, but even if you're a local family doctor, you should show it to him to make sure that that swelling should not be a hernia. If it is a hernia, please ensure that it is correctly diagnosed and correctly operated at the earliest, because you should not linger on with a hernia because of the risks that I mentioned earlier, that they can that the bowel can get obstructed at any stage later on, and that can be a medical emergency. And lastly, you have the option of choosing between various types of operations. Make sure that you go to a person who has got adequate experience in hernia surgery, and then make your considered choice between open and laparoscopic surgery, with all the benefits of laparoscopic surgery in a trained center with a high volume number. I would say that a laparoscopic approach to your hernia would be a better option than the other open type of repair.
Okay, doctor, thanks a lot for being a part of our program.
Thank you very much for inviting. It was a pleasure being here.
So that was Dr. Pawanindra Lal with us. Until we meet next time, this is me, Naina, signing off. Take care.